We're joined now live by the director of the Harvard Global Health Institute, Dr. Ashish Jha. We always appreciate your time. Dr. Jha, this is a really big deal, so let's just break this down. We know that asymptomatic people are one of the driving forces behind the spread of this virus. Is there any scientific medical explanation for why the CDC would make this reversal and say people who don't have symptoms now no longer need to get tested?
Yeah, good morning. Thank you for having me on. There is no scientific basis for this change in policy. As the report said, about half of all spread happens from people who don't have symptoms. And the idea that we're going to stop recommending those people get tested, it will make the outbreak much, much worse. So I think we're all baffled by this decision.
It is a head scratcher. We talk to you all the time. Your lesson is always to us, listen to the science. So what do Americans do if the CDC, the science, now seems to be bowing to political pressure?
Yeah, it's very distressing, right? Because for a very long time, we have known that we could trust the CDC, we could trust the FDA. The scientists who are there are great. They're the best in the country. They need to be able to speak openly to the American people. That's not happening at this point. And I think for Americans, what I recommend is you got to find other trusted sources. But in the middle of a pandemic, we need to be able to turn to our nation's scientists. And I think I and a lot of us are heartbroken that this is where we are right now.
Okay, Dr. Jha, I want to get you on one more thing because there's this new study out that suggests that men might be being hit harder by the virus than women. Why do you think that might be?
Yeah, we've known for a while that especially among older people, men are more likely to get really sick and die. And now we have emerging evidence that women mount a more effective immune response. And that's interesting and that's important. And especially as we think about a vaccine down the road, it's going to be a really important thing to track. It might be that men might need more vaccine shots than women. We don't know. So we're going to have to sort that out. But that it seems to be about the immune response.
Dr. Jha, as always, thank you so much. TJ?
All right, Cecilia, everybody, we'll be back with much more.